I have some very interesting information I want to share with you on a home remedy
To lower the risk of hypertension.
Now, what's fascinating about hypertension is that 95% of all hypertension is called essential hypertension, or it's called primary hypertension, or it's called idiopathic hypertension. All that means the same thing, unknown cause. They don't know what causes it. I mean, that is so bizarre to me. 95% of all hypertension is just an unknown cause. After all these years, we don't know what causes it. Of course, we do know how to treat it though, right? We do know how to treat it with medication. So today I'm going to share with you what I think is the true root cause of hypertension. And so you can very easily deal with it in a natural way. And I'm going to show you an amazing technique to drop your blood pressure if you have high blood pressure within minutes. And it's very, very cheap. In fact, it will cost you nothing. Wait till you hear how utterly simple this is, okay? But first I need to share with you what causes the blood pressure to go higher or lower. There's certain receptors in your arteries called baroreceptors, okay? And you have this whole connection with the nervous system that goes right up into the brainstem. And the baroreceptors are the things inside the arteries or veins that pick up information, and they send it to the nervous system. And this whole thing is controlled by what's called the autonomic nervous system, where you have the sympathetic and the parasympathetic. You see, when we look at blood pressure, we're dealing with systolic, which is the maximum pressure of contraction, and then diastolic is the minimum amount of pressure in the relaxation phase in the cardiac cycle. And normally the systolic should be 120 and the diastolic should be 80 in a normal person at rest. But of course, that's just average, right? It can vary depending on a lot of different factors. When it gets to the point of like 140 over 90 or more, it becomes hypertension. So what can go wrong with this baroreceptor? Well, the first thing that can go wrong is a problem with the electrolytes that control this receptor. And then primarily I'm talking about sodium and potassium. Okay, now what's interesting about what most people are told about high blood pressure is that they must reduce the amount of sodium. But when you start having a sodium deficiency, that starts to create dysfunction within the baroreceptor. So yes, you're going to retain less fluid, right? Maybe drop the pressure, but you're going to create problems within the baroreceptor and activate the sympathetic nervous system. And guess what happens when you activate the sympathetic nervous system? The pressure goes up. So a low salt diet can actually worsen your blood pressure. On the flip side of that, if we take the opposite mineral, potassium, and we go up with potassium, boy, do you create a really cool change with your blood pressure. I really believe that potassium is one of the key factors to help restoring blood pressure. Not decreasing sodium, just increasing potassium and having sufficient amount of sodium, because we need a lot of potassium. We need like 4,700 milligrams of potassium every single day. And very few people get that much. You would have to consume minimally 7 to 10 cups of vegetables like salad per day to get even close to that 4,700 milligrams. But the point is that it's more important to increase potassium than it is to lower sodium. And if you just look at the conditions of a potassium deficiency, which is called hypokalemia, look at one of the big side effects, hypertension. And the next point I want to make is with vitamin D. Now, vitamin D is very important in restoring problems with your autonomic nervous system. And so many people that have hypertension, especially essential hypertension, unknown cause, usually either have a potassium deficiency or a vitamin D deficiency. And so just by taking vitamin D, that might solve your problem right there. Oh, and one more important point I forgot to mention about this sodium. If someone is deficient in sodium, not only do they get a spike in the sympathetic nervous system, but they create a weakness or a deficiency in the parasympathetic nervous system. So this is why it's so important, if you're trying to correct hypertension, not to just focus on lowering your sodium. In fact, this is just not something I just made up. I'm getting this from some pretty interesting data, and I'm going to put that scientific data down below. All right, so this next piece of the puzzle gets even more interesting. Could it be that insulin is one of the primary regulators of your baroreceptors? Because there's even certain therapies that they will give you insulin to lower your blood pressure. Now, what's going on with that? I thought insulin was so bad for you, and then insulin creates hypertension and metabolic syndrome and all these other things. Well, it does sort of, but here's what happens when you have a spike of insulin, you create insulin resistance. Insulin resistance is actually a deficiency of insulin. Insulin resistance blocks your ability to use insulin. Because just think about insulin resistance in general. It is at the heart of metabolic syndrome, which is a combination of hypertension, high blood glucose, fatty liver, and abnormal high levels of lipids, right? Like LDL and things like that. So we have this insulin resistance, high correlation connection with hypertension, especially essential hypertension. Okay. And I'm going to put some data down below to validate that. Remember that unknown cause? I mean, think about if that was broadly promoted. You'd have to get people off sugar, carbohydrates. You'd have to get people on a low carb diet, but they're not going to do that because there's too much money in carbohydrates and sugar. And these refined sugars and refined carbohydrates deplete you of potassium. So based on what I just told you right now, increase your potassium, more vegetables, go on a low carb diet, take vitamin D, or get more sun. Okay, that should help you right there. But I need to show you something, a very simple thing that you can do right now to lower your blood pressure. And just try it out. It will work. And it's simply changing the way you breathe. Okay. I mean, it's so simple. We are going to do what's called paced breathing, and we're going to slow down our breaths to 6 breaths per minute. Now, what's so special about this 6 breaths per minute? Well, apparently that frequency of breathing is synchronized with this baroreceptor in a way that is going to bring your pressure down. And the data on this, specifically the research, this method of breathing is going to significantly reduce your blood pressure, especially in people with cardiac heart failure. It has the ability to increase oxygen saturation, increase exercise tolerance, give you more endurance with exercise. And on top of all that, it's one of the best things to decrease the sympathetic nervous system, that sympathetic overdrive, that
Fight or flight.
dominance that so many people have simply by practicing this method of breathing. I mean, it's cheap, it's fast, it's something anyone can do. And if you ever notice people with hypertension, or especially if they have diabetes or they're overweight, they're not breathing at 6 breaths per minute. I mean, they are breathing pretty rapidly. And this is not something you'd have to do constantly, but just periodically during the day while you're driving or you're at home, just start practicing these breaths. Now, here's how you would do it, okay? You don't necessarily want to breathe through your stomach for this one. You want to breathe through the chest, okay? And you don't want to strain or try to do it with a lot of effort because you're going to activate the sympathetic nervous system. You want to slowly just breathe through your nose, and I'll just demonstrate. Slowly breathe into your chest.
It's a 5-second inhalation slowly, and then a 5-second exhalation.
All right. So that's how you would do it. And that will give you 6 complete breathing cycles per minute, which will synchronize to this baroreceptor and start affecting your autonomic nervous system and bringing your pressure down. Your pulse rate will come down, and you'll feel very calm